Well, Health Minister Doctor Joe Phaahla leads the National World Mental Health Day event in Newcastle, KwaZulu-Natal today. And this is to improve knowledge, to raise awareness, and also to drive actions that promote and protect everyone's mental health as a universal human right. The 2023 campaign will be commemorated under the theme, Mental Health is a Universal Human Right, which serves as a clarion call for countries to improve access to quality mental health services and ensure that the human rights and well-being of people with mental disorders are respected and upheld. SABC News reporter Vusi Khumalo is covering the story for us and joins us live. Vusi, a good morning to you. I think it really goes without saying just the importance of a campaign and certainly work around mental health care being so critical, particularly in this country. What are you seeing taking place there today?
Yes, it's one of the most important. It's a global event because, as you know, that it's a World Mental Health Day, something that is celebrated or commemorated worldwide. We are in Matadeni, a township. It's a township that is found in Newcastle under Nomagugu districts and municipality in northern KwaZulu-Natal, where the national department is staging this world commemoration today. As you know, that there are, according to the World Health Organization, they are saying that in every one person out of the 8, they live with mental health disorders. So it's one of those silent killers that is known worldwide, and it also claims about 700,000 lives annually. So you can see how serious is it, and that's why the department, both from the national and the provincial department, are staging this event to commemorate it here in KwaZulu-Natal. I am joined by MEC of Health in KwaZulu-Natal, Nomagugu, Simelane, who's here to talk to us and also perhaps deliberate on why this event is staged here and also the importance of it as well, because we know that it's something that's not many people know about it, yet it's just got so much consequences if it goes unchecked.
No, thank you very much. Indeed, today is an important day. It's a mental health awareness day that is celebrated or commemorated throughout the country. The intention of this program is to conscientize our communities about issues of mental health, particularly in rural areas and townships as well, where issues of mental health to a certain extent have been neglected. And in other communities, communities themselves don't often believe that people are actually able to suffer from mental health illnesses. So today's program is to say to people, everyone or anyone can actually suffer from a mental illness, and mental illnesses are just as dangerous as any other physical illness or any other health matters that we must take care of. You know, in the elderly, those that suffer from dementia, for instance, sometimes we find them being accused of witchcraft just because they probably had left in the evening to go out and relieve themselves. And when they are supposed to come back, they don't remember which door they must go in, and they are found in different homes because dementia is that kind of a disease that actually makes you forget something that you had just done a few minutes or a few seconds ago. So today's program is meant to conscientize all of us. It's meant to say to all of us that you know, mental illnesses come in many forms, and all of those forms are actually just as dangerous, and there is no form of mental illness that should be looked down upon.
Okay, and also what sort of roles can our communities play in order to ensure that they do prevent and also support people with or living with such conditions in our communities?
Well, the starting point is to request communities to not abuse drugs, alcohol, and so forth, because some of the mental illnesses are actually brought about by substance abuse. So our first call is to say substance abuse must actually be stopped, so that we understand that our health, our mental will continue to be in good state for a very long time. Then moving forward, we want to say to communities, we do have a role that we can play in supporting those that are currently affected by mental illnesses. We have in hospitals, we have mental health boards, and those are meant to be boards that are linking us with communities so that we can make sure that we link with hospitals, we link communities with a particular service of care. So our communities can link with those people because they actually come or are within themselves. But beyond that, we want to say to communities, as a Department of Health in KwaZulu-Natal, we have started a campaign of giving symptoms or speaking to communities about symptoms of the different mental illnesses that are out there. And should we see a family member that is affected by any of those, should we see a neighbor, should we see a friend that is affected by any of those, firstly, we must understand that that person needs our support. And secondly, let's make sure that that person gets the mental attention that they need.
What are some of those symptoms?
Well, you've got a number of illnesses, really. Depression is one of them. Dementia is one of them. So, you know, the symptoms are they vary. You have schizophrenia that is also a illness and has its own symptoms. But dementia in particular, because it affects a lot of our elderly, we see, you know, once you start seeing someone who's, say, above 60, start losing or forgetting things that they had just done or something that we have just spoken about. And by the way, that thing doesn't happen overnight. It's a gradual loss of memory, and it's short-term memory more than the long-term. You find that they will remember who was their girlfriend when they were in high school, but they forget who you are when you are standing in front of them and you are their son or their daughter. So such things, they become an indication. Of course, it's not general, but we are saying once you see something like that in your grandfather, in your grandmother or mother or father, let's go to a health facility, and those health workers that are there are going to be able to assist us.
Speaking of those healthcare workers, are they equipped enough? Are they fully resourced? Do they have enough facilities in order to deal with this effectively? Our primary healthcare facilities.
As a province, we do have enough facilities in the province that deal with mental illnesses. We have 7 hospitals in the province. However, at a level of primary health care, as you indicate, the health workers are trained generally on all aspects of illnesses, including mental illnesses. Of course, there are those nurses that specialize in mental illness, and their training then is at a higher level. But all the health workers are given a certain level of training, particularly where they are taught how to identify the symptoms that are there, and then they need to refer upwards. Thank you very much.
Okay, that's MEC for Health in the province of KwaZulu-Natal, Nomagugu, Simelane, saying that this is one of the most important events that the department is also staging here in the province of KwaZulu-Natal. As you know, that mental health disorders are the causal factors of the suicide, which account or claims about 700,000 lives annually, and there's quite a number of people. They are saying that 1 in 8 people are affected by these disorders. So that's why the department is saying that it's staging this year in order to conscientize people and also try to galvanize efforts in order to ensure that there is a quality access to the healthcare facilities and services in the province of KwaZulu-Natal and also in other provinces as well, Naledi.